folks. So let me just share my screen here really briefly. Susan, can you confirm that folks are able to see this? Awesome. All right, folks. Well, thanks again so much for being in this virtual space with us here today. So generally, our plan for today is just to share a little bit about our prevention funding opportunity, which is through our Community Prevention Partnerships Program, which I will shorten to CPPP oftentimes throughout the presentation. And so again, this is just to learn a little bit more about this opportunity and then allow y'all some space to ask some questions as well. So briefly, just a little bit about me. So my name is Hunter Beckstrom. I use he, him, and his pronouns, and I'm the Prevention Program Coordinator here at the Minnesota Coalition Against Sexual Assault. So I've been here for just over a year and a half, and I'm very excited to be starting with working with the new cohort that would actually start this upcoming July. And folks might have noticed already a little bit on a personal note, I'm not feeling 100% today, so my apologies if I have to sneeze or blow my nose or do all these other very unappealing things. Just if you can. All right, and of course, the last slide is going to share my contact information, so please keep that in mind. And when after we're done with the training today, hopefully in a couple of days, I'm also able to send folks the recording and then also the slides. So you're going to have that for yourself as well. All right, so here just wanted to share a little bit about our organization in case some folks might not be familiar. So again, MNCASA stands for the Minnesota Coalition Against Sexual Assault. And generally, we are a statewide member-driven sexual assault coalition, and we really identify ourselves as technical assistance providers. And our role within that is really to work with systems professionals that offer direct services to victims and survivors of sexual violence. And most oftentimes those folks are advocates at local rape crisis centers, for instance, but this can also be folks who might be on sexual assault response teams, for example. So folks like this might be law enforcement or healthcare professionals, or also other individuals from the criminal legal system as well. So kind of what I like to say is that our goal here at MNCASA is really to help direct service providers be the best direct service providers they possibly can be. And the way that we're able to offer that is that we create tons of different trainings, webinars, we create a bunch of resources, offer supports and capacity, and then are able to make connections on a statewide level as well. So of course, if folks are interested in learning a little bit more about MNCASA, please feel free to check us out at the link on the right-hand side, or just reach out to me if you have questions as well. All right, so getting into it here, just wanted to share a brief agenda about what we can expect with our time here today. So first and foremost, we're just going to dive into a little background of our Community Prevention Partnerships Program, what I will also refer to as CPPP throughout the presentation. Secondly, we're going to share some of the details on the request for proposal and how folks can apply as well. Thirdly, we're going to just share a little bit about some of the links between sexual violence prevention and anti-oppression work and how that is really rooted within our work as an organization, but certainly within the CPPP program as well. And as I mentioned, hopefully we can have a decent amount of time just dedicated to answering some questions that you all might have as well. So I know that we've had a few more folks join us, but please, if anyone does have any questions, feel free to throw that in the chat or unmute yourself. Again, this is a very informal space, so please don't hesitate to interrupt me if you'd like. All right, so getting into it here, number one, so what are we actually funding here at MNCASA at the CPPP program? So we're actually awarding generally $225,000 over the span of 3 years. So that is $75,000 per year to 2 culturally responsive or culturally specific community-based organizations. And of course, these organizations are really emphasizing sexual violence prevention work within Minnesota. And of course, when we're talking about prevention here, we're talking about strategies that emphasize primary prevention. So really trying to be proactive in combating sexual violence before it ever has the chance to occur. So that's really primary prevention there. Additionally, some of these other ideas that are very important to be aware of is that we are for sure having one of these organizations be a MNCASA member organization, which I know a lot of folks here are, but we are also open to funding folks outside of MNCASA's membership, depending on the project descriptions that we receive as well. And then finally, did want to share that we really aim to fund organizations that are planning to expand upon their current prevention work. And so here we're really anticipating assisting in expanding and helping folks build capacity for what they want to do in terms of prevention. So certainly it's very important to continue doing the prevention work that most folks here are doing already, but with this funding, we really aim to expand upon that. So, for example, if your organization has really been interested in trying some new programming or new prevention strategies, or even purchasing a new curriculum, this might actually be a really good opportunity for you all to kind of venture out into a new area of the prevention work that you might want to be doing coming up soon. So any questions? Just wanted to pause there just for a brief moment for folks. All right, sounds good. Well, of course, please feel free to throw something in the chat or unmute yourselves as well. All right, next slide. I just wanted to jump into the eligibility. And so there's four main pieces in which people might be eligible for the CPPP funding here. And so first and foremost, we are really looking to fund organizations that are utilizing primary prevention strategies with a certain community, And so that can just be one of these types of communities or populations, or you can work within a variety of populations. So for example, some of these communities might be folks of color, indigenous people, folks from the immigrant and refugee populations, LGBTQIA+ folks with disabilities, and generally any other type of community that might be targeted by oppression. And that really ties into the second piece, is that we are really trying to emphasize an idea between primary prevention, sexual violence prevention, and then tying that to anti-oppression work as well. And so I am going to share a slide a little bit later on that hopefully can visualize what this looks like a little bit better. And then I'm also going to give some very specific examples about what people might be interested in doing as well. You can also see that we do require applicants actually have at least one local community partner. So of course, that really depends on the different programmatic deliverables or strategies that you are trying to utilize. But generally, some examples can be your local school district. It can be an advocacy organization, a teen clinic, a faith-based establishment, an art center, or another violence prevention organization, because we know that folks might not just be from a local rape crisis center that are applying for this funding. And one thing that we're going to talk about a little bit later is that we're really talking about bridging expertise here, and that's why it's so important to have that local community partner, and the importance of actually doing some community level work in terms of your primary prevention strategies as well. And then finally, we did want to share that unfortunately for organizations that have received previous CPPP funding, those folks are ineligible at this point. So just to give folks a little bit of a brief historical perspective, this will be the fourth cohort starting in the CPPP program that will begin in July. So there's been 3 other cohorts a part of this. So unfortunately, if you have been a part of that, you would be considered ineligible. However, different organizations a part of MNCASA's membership might have received some previous mini grants. And even if you have received those, you are considered eligible there as well. So any questions on these 4 main pieces of eligibility for folks? All right. Sounds good. Well, we'll jump into the next slide then. And so obviously really important that we wanted to share the dates in which folks should be aware of. And I do want to apologize just because when we had first sent out the initial RFP. There was actually a misprint, so it had shared that proposals were due. It said both on Wednesday, May 25th, and then also May 13th. Just want to be very clear with folks that it is the proposals are due Wednesday, May 25th.
Hunter, I wanted to share, there's one question from that says, does law enforcement count as a partner?
They would count as a partner. Obviously, again, that emphasis on community-based partnerships as well. I think it would really depend on, what some of that work is. One thing that I do want to make clear is because we are really trying to emphasize this idea of anti-oppression work, depending on some of the communities that you might be working with, those prevention strategies that, again, we're really trying to focus on primary prevention. Due to some of the strategies and experiences of some populations, you might actually be doing some prevention strategies that are more intervention and responding. But please be aware of the fact that, we are wanting to be very flexible within this. So of course, law enforcement would be considered an approved local partner, but it really does depend on what some of those strategies what encompasses that partnership. So again, if you do have more questions, we'd be happy to dive into that a little bit deeper as well. All right, so just getting back here in terms of important dates. So we did actually release the RFP on Tuesday, April 26th. And again, just want to be very clear that the proposals are due on Wednesday, May 25th by 5 p.m. Going down throughout the slide further is that we are going to notify the 2 recipients that they have received the award on Wednesday, June 15th. And then if for folks who are selected, they would then begin on July 1st when that cohort would start.
Hunter, did you want to highlight the typo in some of the documentation about the due date?
Yes, yeah. So I did just briefly mention the fact that the initial RFP that had gone out, there was a misprint where it shared that both there were 2 conflicting proposal due dates, which was Wednesday, May 25th and May 13th. But please be aware that it is Wednesday, May 25th, not the 13th in which these are due. And so it looks like we had another question in the chat from Pamela. So who will actually be reviewing the proposals? So of course, we have our prevention team at MNCASA that will be reviewing these proposals, but we are also going to loop in some other folks at MNCASA who have some knowledge or expertise in terms of prevention that will be assisting us in that review process as well. And kind of connected to that same piece here, there's also going to be kind of a second phase for some of those, excuse me, a second phase for folks who are having some very promising project descriptions. And so this actually includes some finalist interviews. And so you can see on the slide that we actually already have some very specific dates in which these interviews might occur. So you can see on the slide that it's going to be Wednesday, June 10th between 1 to 4 p.m., Thursday, June 11th between noon and 4, and then finally Friday, June 12th between 9 and 4 p.m. as well. So we did just want to make sure that folks kind of were aware of this so they can tentatively plan to hold some time during that time as well, if they would be chosen for these finalist interviews. And what folks can really expect from this is that generally it would only be about an hour interview, and it would really kind of be diving in deeper to some of the different aspects of what you had shared within that proposal. So of course, the project description or the work plan, and then also the budget as well. And then finally, again, similar to this, just offering another additional space for folks to ask some more clarifying questions as well. So looks, just want to check. So it looks like June 10th is a Friday. Just want to make sure again that we're not confusing any folks here.
Hunter, I think that is accurate. So it's actually June 8th, 9th, and 10th.
Okay, gotcha. Well, our apologies there. So again, thank you, Pamela, for sharing that. So let me look on my calendar here. So yes, this is going to be the 8th, 9th, and 10th rather than these dates. So our apologies there, but I will make sure to update this before we would actually send it out to folks. So again, thank you, Pamela, but those dates are going to be the 8th, 9th, and 10th of June. Rather than what you're seeing on the slide, but those same those time slots will be the exact same as well. So thank you again. All right, so in terms of what folks can expect with submitting the actual proposal, again, just wanted to share some of the important dates that the proposal is going to be due on Wednesday, May 25th. We do prefer that would be via email just due to ease of accessibility, but of course, whatever is going to be easiest for you all. So if you are interested in mailing that to us, you can find that specific mailing address on the slide there. And again, if that is what you decide to do, please have that postmarked by May 25th as well. And then in terms of, what folks can expect with this project proposal letter and then budget. So generally, we've discovered that in the past, folks have about 2 to 3 pages for the actual project work plan or description that they would send in a letter format to us. And then when we're talking about the budget, that's typically about a page we have seen. We did want to ensure that this was very flexible and accessible for a lot of different folks. So we didn't want to have like a 12-page proposal by any means. So really tried to do whatever is going to be best for all the applicants for this proposal. But just to share that if folks are a little bit liking a little bit more of that structure as well. So typically we've seen about 2 to 3 pages for that work plan description and about 1 page for that budget, just ensuring that you are describing how, for example, year 1 with your budget might be vastly different for year 3, for example. So also looking at the chat briefly, so it looks like Allison is asking, in the proposal, do you want a budget outline and a budget justification or just the outline? And so typically here, what we're interested in is we do want the specific numbers. And so that would include a general outline. Of course, you can't anticipate anything and everything that might be able to happen there. For example, with our most recent cohorts, our 3rd cohort, they actually got extended a full year due to COVID, but just anticipating what you think would be best for you. And Susan, I think I saw you unmute if you had any pieces you wanted to add in on there.
Nope, I do not.
Sounds good. And then are there any formats or proposal letter and budget? Okay, so we don't have a typical template or anything like that. So again, we are just wanting to make sure that being flexible and most comfortable with whatever you see as fit for your own organization. If folks are interested in having a very specific template, please feel free to reach out to me individually. However, I imagine some organizations might already have some predetermined files and documents that they can utilize for this already. But of course, if folks are interested in a template, please reach out to me via email as well.
Hunter, typically what we've seen is the letter is on organization letterhead, and it really is in a narrative form. So it's just a narrative description of the project, proposed project.
Yes, thank you, Susan. And so we have another question that, are there any limitations for the indirect cost for the budget? And I do believe, I can't remember, I believe it's in the RFP, but I think, Susan, do you happen to remember if it's perhaps like 5 or 10%?
I think it's, I will double check and get back to you quick here.
Awesome. Yes, so Susan, if you could just throw that in the chat when and if you are able to come across that. But of course, if we're not able to find that in this direct time, we'll be able to follow up as well on that. So we also wanted to share a little bit about what this collaborative partnership, both between MNCASA and the potential grantees, would look like as well. So of course, for MNCASA's role, again, how I was talking about previously, that we are typically seen as technical assistance providers. And so we would be able to build your capacity in whatever type of prevention strategies you are looking to implement within your community. And additionally, we would have potential site visits, of course. Within the last couple of years, these have all been virtual, but prior to that, they had been in person. So depending on how things might change moving forward, there could be an opportunity for in-person, but at least for the short turnaround time, these site visits would be virtual as well. And additionally, we do have the assistance to be able to offer in terms of evaluation capacity building. Susan is actually our prevention team's evaluation consultant. And so obviously we know that this is a huge aspect in terms of prevention, so important, but it can be very difficult at times. So we know that Susan is a huge help within the CPPP program. And if folks do have any questions in terms of evaluation, she would be a great resource for you all. Additionally, just some expectations from the potential grantees or recipients. We do have some mandatory quarterly meetings, and that's typically what we call those site visits with our cohort members. Additionally, there is obviously reporting as well. So kind of similar to what we were talking about with the actual proposals, you will have to develop some narratives based on the updates that you have to share with us, and then also sharing some budget reports. Just because we are the folks that are sharing out this funding, this is housed within the Minnesota Office of Justice program. So we are then required to report what is going on with the grantees as well. So it looks like someone asked if the RFP is available online. I will share that in the chat again. 1 second, please. All right, so you should notice in the chat that it is the available online link as well. All right, and we did just want to share really briefly about some of our typical lessons learned that we've had throughout this entire process. So first and foremost is the idea that there are some potential limitations of the single staffed prevention team. And we actually, previously, we had some requirements that the $75,000 that folks would use each year was actually had to be dedicated towards a full-time prevention person. And so we are not requiring that anymore. But of course, if you would like to dedicate that $75,000 to ensure that you have a full-time prevention person, that is totally up to you. Or you can certainly be able to distribute that across, 5 or 6 staff with different forms of FTEs as well. But one thing that we've noticed has kind of been a limitation of the single staff prevention team is just the fact that we know that advocacy in this field generally is very high turnover. So if you have not really created an organization that has a lot of investment in terms of prevention, and you have a single staff prevention team, and for whatever reason there is turnover within that position, then there could be months and months without any type of legitimate prevention work going on. So just wanted to share that that has certainly been a barrier to different cohort members in the past, but of course, we're not having any type of restrictions when it comes to you having to have a full or a single staff prevention team, or utilizing that $75,000 just for one prevention person. So just wanted to share that piece as well. Additionally, just in terms of partnerships, it's very important that partnerships can really make or break some of your prevention strategies that you are trying to implement within the community. So really ensuring that these partnerships are they're equitable exchanges, and that is going to be mutually beneficial for all of the participants involved. And so that can take a long time to actually develop some very meaningful partnerships, right? And so of course, if you have just kind of been in email contact with some potential partners in your community and utilized that partnership for the proposal, certainly that is not to say that that is going to be less impactful, but just being aware of that, we want these to be very meaningful and very authentic partnerships. So that can take a lot of time, and due to, for whatever reason, we know that at times there can be disruptions within partnerships. So just due to the impact of COVID or due to transitions in these other local community partners, just being aware of that, really ensuring that you're trying to be as authentic and having these equitable exchanges as well. And then finally, really want to be really want to ensure that folks are looking ahead about planning for the future to sustain their prevention work, not just throughout the 3 years that they would get this grant, but past that mark as well. So really, how are you going to create an organization that really has a lot of investment for prevention? Of course, there's probably a lot of organizations represented in this space that have that already, but we know that, again, MNCASA's goal in trying to build capacity for organizations in this area, that's definitely a very important piece within the CPPP program as well. All right, perfect. So those were just some general lessons learned, of course. Again, don't want to try to restrict any type of use of funds or how you would be able to utilize the FTEs for this work, but just wanted to share some of those general lessons learned that we have experienced. All right, so now I just briefly wanted to touch on this idea of sexual violence prevention work with anti-oppression work. And so what you see on the slide here right now is actually what's called the Sexual Violence Continuum. And I believe this was developed by a person by the name of Lydia Guy from the Washington Coalition of Sexual Assault Programs. And you can see that within this continuum, obviously at the very dark piece on the outside of the circle, norms are constraining these different types of behaviors or values, you might consider them. So of course, there's very explicit examples of sexual violence. So of course, rape, marital rape, incest, things like this. And as you kind of go to the middle of this, we find that additionally uplifting and reinforcing violence are rigid gender roles, sexualized media depictions, typically of folks of color or women, and then leading to, we know that sexual violence and oppression are inextricably linked together, right? And so the goal within some of our strategies is really to be aware of the fact that, you know, not just one type of oppression. So if we really focus on sexism, we know that just eliminating sexism is not going to truly prevent sexual violence from ever happening, right? We really have to be able to look at this from a very intersectional lens and be able to, you know, pinpoint a lot of our sexual violence prevention strategies within different forms of. And so again, just wanted to be very clear on, you know, that again is one of our goals for this funding, is to be able to conjoin our sexual violence prevention work with anti-oppression work as well. So any questions there at all, folks? All right, perfect. So just have one more slide that I wanted to share with you all. And this is actually, just wanted to share some very tangible, clear examples of what merging together sexual violence prevention and anti-oppression work can look like. And so some folks might be familiar with a national prevention resource called Prevent Connect, which is actually housed within Valor US, which was formerly CASA, the California Sexual Assault Coalition. And so I found all of these within Prevent Connect. And when I send out the slides with you all, those are all within the notes, so you can get some more very clear examples. But you can see here on the slide that these are 3 examples of organizations merging together sexual violence prevention and anti-oppression work. And so number 1, we see the Michigan Coalition to End Domestic and Sexual Violence. They really sought out to kind of green their spaces within their community. And this was actually a 5-year effort. And the ways in which this really looked like was really trying to identify some local parks or shared communal spaces and trying to green them or create them more accessible. And again, and that main goal was just to increase that communal utilization and equitable access of those spaces where people can come together in a very safe way. And I think this is, it's really important because it talks about the community relationships here as well. So as I had mentioned before, that perhaps the Michigan Coalition did not have a lot of those the expertise in knowing how to green a space, but they did have that perspective on sexual violence prevention. So really partnering with communities who have that access to different communities or populations or how to green that space. So really trying to bridge your expertise together is just another example of what we're trying to share here today. Additionally, this second organization, I believe it is the El Programa Hispano Católico. And so the EPHC, this organization was actually a part of the Oregon Coalition's, what they have called the Prevention Through Liberation program. And that is actually set up very similarly to MNCASA's CPPP program. So it's really nice to see how some of this work can be very similar across the United States as well. But some of the work that EPHC was doing was really being able to engage with culturally specific youth in trying to empower them and to create some very awesome community building work together as well. And this was really a program that tried to have some very important project deliverables that really pinpointed some arts-based education and social media awareness that those culturally specific youth would then be able to build those skills for themselves and then try to create that community type of mobilization to then create change within their own communities. All right, and then finally we have MESA, which is the I believe it is the multicultural efforts to end sexual assault. And within this, the specific populations that were involved were some of the Latinx and indigenous farm workers, and really trying to build some partnerships within these different populations and sharing in what they had called a kitchen table leadership. And so this was really trying to align some values that really were grounded in cultural traditions, but then also these cultural traditions were really grounded within communal values that also led to sexual violence prevention work as well. And so here, just wanted to share some 3 general ideas about, again, what this idea of sexual violence prevention work and anti-oppression work can look like as they're merged together. So in no way was this to say that, if you're not doing something similar to these 3 organizations that you wouldn't be considered. These are just some different examples that are very clear and tangible. And of course, this was just a very quick, 2-minute recap of what these organizations were doing. So if you are interested in looking a little bit more at them, again, once I send out the slides, you can find that link as well. All right, sounds good. So just wanted to check in any questions with the content that I have shared so far. All right, well, with that, that was really all of the content that I had wanted to share with you all. So hopefully you've kind of gotten a solid idea of, what the CPPP program is, some of the eligibility requirements, and then also kind of the work that we're hoping folks might be able to expand upon. But now I think we have about 20 minutes left. Just wanted to open it up to you all if y'all had questions, anything like that. And I actually want to go to the next slide because folks can feel free to reach out to me directly, either by phone or via email if they did have questions that might come up later as well. And feel free, so I know that someone shared in the chat, but feel free to unmute as well. But it looks like Julie is asking, what is the frequency of narrative and budget reports? And so thank you so much for clarifying that. So that is actually going to be twice a year. So this is going to be biannually, in which we are getting that information from you all, because that is what the Office of Justice programs require. But as I was talking about with those site visits, those are quarterly. All right. It also looked like Yvette was asking with some of the programming that our organization is currently doing, is it possible to request to offset what we are expanding upon as far as the current boosted outreach efforts? Yvette, would you mind unmuting and expanding upon that a little bit? I just want to make sure that I'm clearly answering your question.
Okay, so with me being fairly new to the organization, and so all of the increased programming and preventative efforts that our organization's been doing, not necessarily having the full capacity for that, but just kind of with, I guess, with the exposure and the outreach, it's kind of, it's like you're adding more to your plate. But then yet, how like things are changing now as far as getting qualified candidates to kind of fill some of those roles that are in a different capacity. Is that something that could be utilized to help strengthen up the staff base? Because, we're looking for more competitive applicants that could do that preventative work, especially when we're expanding in our counties that we're servicing. Is that?
Yeah, absolutely. So thanks for that clarification there, Yvette. And I think within that, we just know that, especially right now, just because of so much emphasis on response right now, that prevention has kind of been set on the back burner for a lot of organizations. So we do want to be aware of the fact that a lot of folks haven't been able to focus as much on their preventative work that they have wanted to. So certainly being aware of that. And then, excuse me, as I was kind of mentioning with, if you wanted to actually have a full-time prevention person, or if you wanted to distribute that $75,000 per year across, your multiple programs in different counties, however that might look like. So of course, really being able to outline, what you anticipate doing with some of this additional outreach upon what you're already doing, right? So again, going back to that idea of really trying to expand upon what you are currently doing. And so digging deeper into some new strategies or new ways of engaging within the community. So I certainly think that that's a very important question, Yvette, and then also would be considered eligible for applying for this as well.
Yeah, because I was looking at it more so like with a bunch of the new partnerships that have been identified, and it's like you can only do so much, and it's like it's hard to do that without some of that funding. So yeah, no, it gives, I don't like spill the beans with everything, but yeah. Okay, thank you.
And yeah, of course, like, with that requirements of having a one local community partnership, it can just be like one, local school district, just like us, one specific middle school, for example. It doesn't have to be, many folks a part of that. Just again, we're trying to focus on that community level prevention work again.
Okay.
All right, looking at the chats again, it looks like Erica was asking, so if we don't think that our organization is the best fit for receiving the grant to lead our work, but think that there's a potential to serve as a community partner for a grantee organization, any suggestion for how we might go about making those connections? Thank you so much, Erica, for bringing that point up, because I think that is a very good point. So it just depending on the capacity and what you're able to do or not within your community, it's exactly what you're saying, might fit a little bit better to actually have a different local organization kind of be the main folks doing that work or receiving that funding, whereas you would be considered that community partner. I think just kind of working with whatever that other organization might be, ensuring that you kind of have some clarifications. If you want to have some type of MOU, so a memoranda of understanding in place between your organizations, I think that would be super helpful. But of course, I think that was a very important point to bring up, that your organization might not be best situated for a number of reasons. So really trying to make some of those connections elsewhere. So it looks like Comfort had also asked, what do you define as culturally specific meaning within this RFP? Of course, so what we mean when an organization is either culturally responsive or culturally specific is meaning that they are working with a specific community or communities as part of their direct service. So, you know, for instance, Comfort, you work with, to my knowledge, with African immigrants and refugees as well. So that would be considered a culturally specific organization. But I think importantly, what we're trying to differentiate here is to say that we're not talking about more like mainstream organizations that have just kind of like work with, for instance, LGBTQIA+ people and a variety of other types of populations. We want it to be specifically grounded within at least one specific community. So hopefully that kind of explains it a little better. And I do have some more resources that we've actually utilized ourselves to make sure that we are kind of utilizing the same understanding to what other sexual assault coalitions are across the United States as well. All right, another question is, would community assessment / focus groups to review a specific population's current awareness of sexual violence prevention, anti-oppression be an appropriate action in an organization's work plan? Just want to review that again. And Jan, if I could actually have you potentially unmute yourself and clarify a little bit, because would you perhaps be talking about like a strategy within engaging the community with those focus groups, or even talking more specifically about an evaluation method? I just want to make sure I'm understanding.
Yes, it could be one and the other in terms of the population that the organization I work with. You know, one of the questions we would have when we were reviewing this is, well, you know, what is the awareness of access to resources? What causes, what are these root causes, so that we as an organization can gather perhaps what focus groups do we need to have to help us plan, get the community engaged with us to help plan the activities, help them be a part of defining what the problem is specifically within their population. So to do that, would community assessments and focus groups be considered an appropriate work plan action for this?
For sure. So thanks for clarifying that for me, Jan. And I would certainly say so. I do think one thing that we are really trying to be aware of, and perhaps Susan could touch on this a little bit more in depth as well, but the idea that in terms of evaluation, we're not just looking for, you know, change in perspective or, you know, and what people see as just awareness. We really want to push the needle in terms of behavioral change. And we know that that's kind of difficult to evaluate, but it's very important to be able to evaluate those measures to see different social norms or community values as well. But Susan, I saw that you unmuted, so if you wanted to share a little bit more in depth there as well.
Yeah, I mean, I think that would be an appropriate thing to do. It's kind of like an environmental scan to see what the current state is and where you need to expand, because I think again, so much of sexual violence work stops at awareness, and that's what we're really trying to move beyond into more behavioral change. But awareness does have to happen first. And so depending on the community and where that community's at, that may be the first step. And so I think that would be absolutely an appropriate thing for a work plan, especially at the beginning as you're defining where to go forward.
Wonderful. Thanks so much for that clarification, Susan. And also to Comfort's additional question in the chat about planning to be would planning be an acceptable part of the activities for those who are just starting to do this work? Very similar to what Susan was talking about in terms of that right there as well.
I do think, and I just want to make the caveat though, that we have learned in the past that hoped for partnerships don't always pan out. And so we really do want to make sure that those partnerships that are required to do the work have already been put in place, so that because we have had grantees where they had hopes for creating a partnership and it didn't pan out, and that made them not be able to continue with the grant process. So I do think it's important to have some specific partnerships in place already.
Thanks so much for that clarification again, Susan. So I'm actually going to stop sharing my screen just so we can open it up and hopefully I can see some of you folks. But again, we have about 10 minutes left. So if folks have some additional questions or, just wanted to kind of dig in deeper to some other ideas, would definitely be up for doing that. But please just know that feel free to reach out to me from now or until any time until the RFP is due, which again is Wednesday, May 25th. And I have already met with a couple of organizations one-on-one. So if you are interested in doing that, just to hear a little bit more directly about what you might be interested in, please don't hesitate to reach out as well, as I would be happy to do that. All right, so another question in the chat is asking, will the organization need a letter of support from the community partners to submit with the proposal? And so we are not requiring a specific letter of support from whatever that local community partner is, but we did share that, those are certainly encouraged, but that is not required at all either. Any other questions that folks might have? And Susan, if there is anything that I may have left out of the PowerPoint that you think would be helpful to share, please do, just because I know that Susan has mostly been a part of every single cohort since they had started, I believe, in 2014 as well. So again, this would be the 4th cohort that would start this coming July as well.
Just a quick question. This is Angie with Asian Media Access follow-up for the supporting letter. So with or without supporting letter would be fine, but if with supporting letter, will that adding on the point for evaluation?
I'm not sure I understand the question. I'm sorry.
I'm just wondering if that, what would be the criteria of scoring if including supporting letter, with that scoring higher?
So you're not asking a specific evaluation question, you're asking about the scoring of the applications for determining the who are the interviews and the finalists. And I would say yes, that letters would add points to the application.
Thank you.
Yeah, and I believe
this is Pamela. I think you need to put that in writing, because if you're telling people that it's not, that you aren't asking for it, and now you're saying in fact that it would influence the how you're going to choose people, I think everybody needs to know that for equity.
Thank you so much for that comment, Pamela. Yeah, that's very important. And I think in terms of the RFP, there was, I won't remember the numbers offhand, but I think the budget itself, the scoring rubric is like 50 points, and then the budget is 25 points, and then the organizational capacity is 25 points, if I remember offhand as well. Looks like Mans is sharing in the chat that letters of support are discussed. Yeah, just briefly in the RFP saying that it's not required, but it is encouraged again. I did just want to follow up briefly on a question I believe that Yvette had shared, and that is the idea of those indirect costs. So it does look like we weren't able to, we didn't share a specific number, but I would be happy to follow up with that directly with you, Yvette. And then if other folks have questions that we weren't able to answer today as well, would certainly be able to offer some explanation or some answers in a different space as well.
Hunter, I may need to correct myself, and you can respond as appropriate for the scoring, because what we do say in the RFP is that letters of support will strengthen your application. So we don't specifically have a specific point number allocated to whether you have letters of support or not. So it's not you get an additional number of points if you have letters, but we want to state that those kind of letters, again, demonstrate that those partnerships are in place, and that would be a strengthening factor for your application. And so, Hunter, you may need to respond to that if I've misspoken.
No, I'd say that's completely accurate, Susan, as well. But if folks do have any questions, again, that we're not able to answer here, we'd be happy to follow up too. So I know that we only have a few minutes left. So if folks have any more questions, please let me know. But hopefully within the next few days, we will actually get the recording and the slides sent out to everyone that attended or that had registered and were not able to attend in person today. But please know again that I would be more than happy to sit down and do a one-on-one meeting with folks if they have some very specific questions on some of the deliverables or strategies that they might be utilizing. Certainly want to be as much of a help as we can prior to when those proposals are due, which again is Wednesday, May 25th. All right, well, with that, it looks like some folks are falling off and everything. So again, just want to say thanks so much for folks who had joined us in this space today, and we will follow up with the recording and the slides, but please don't hesitate to reach out. So I hope everyone has a wonderful rest of your day.